You may know someone who takes prescription opioids, OxyContin or heroin or a similar drug. Very often they overdose beyond the reach of a nurse or a doctor. In this video, we will discuss how to properly use naloxone nasal spray in different settings and circumstances. We will also discuss how to safely use that naloxone.
Anyone who uses drugs or medications can overdose. If you suspect that someone has overdosed on opioids, do not slap, punch, place ice on the body, or burn skin to try to get their attention. Instead, call their name, and if they are still unresponsive, firmly rub your knuckles up and down the middle of the person's chest along their sternum. Step 2. Call 911. Tell them your location and the person's symptoms and wait further instructions.
921 Elder Glen, my daughter's passed out. She's not responding. I need help.
If a group of people are present, clearly identify someone and have them call 911.
Hi, yes. Yeah, we're at 878 North 6th Street. Yes, my boss is unresponsive.
Step 3. Administer naloxone. Peel back the package to remove the device. Place the tip of the nozzle in either nostril of the person overdosing until your fingers touch the bottom of their nose. Press the plunger firmly to release the dose into the overdose victim's nose. Do not give them cocaine, caffeine, or any other type of stimulants or uppers, as this may cause harm, putting additional stress on their heart. A single dose of naloxone may not always reverse opioid overdose. A second dose may be given in 2 to 3 minutes following the first dose, in the other nostril if you have another dose available. Step 4. Place them in a rescue position. The overdose victim's face and body should be turned to the side, top hand placed under the head, and top knee bent to support their body. Step 5. Do not leave them alone. Wait until EMS arrives. It is important to stay with the person to make sure they don't overdose again when the naloxone wears off in 30 to 80 minutes. Other common response myths to avoid that are ineffective or may cause danger include salt water, Suboxone, cold showers, or use of milk. When you call 911, the police may come. Sometimes people are afraid to call 911 or talk with the first responders for fear of getting in trouble. But if you don't, the person could die. If the overdose victim refuses to go with the paramedics, stay with them for the next few hours and encourage them to contact a local treatment center. Now you have been trained on how to properly respond to an opioid overdose using naloxone nasal spray. This training could mean the difference in you playing a life-saving role and potentially preventing an opioid overdose death. If you have naloxone and know how to use it, you can save a life.